We are back with Dr. Shane Hudnall with Cone Health Sports Medicine Center. So let's talk about this. How about medications or maybe medical conditions that people should be aware of that it may increase their heat illness?
Yeah, and there's a lot of medications to think about, but I'll go over some of the most common ones. So, blood pressure medicines like diuretics. So, if you're taking hydrochlorothiazide for your blood pressure, that increases your risk of dehydration, which is a big risk factor for heat illness. Other blood pressure medicines like metoprolol, which is a beta blocker, that's another one that it decreases your body's ability to sweat. And again, sweating is our really important cooling mechanism. And allergy medicines do the same thing. So your Sudafeds, your Benadryl, which we'll take from time to time, same thing. They decrease your body's ability to sweat. So just understand that if you're taking those medicines, you're at higher risk. Now, as far as medical conditions, so if you have a fever, so your temperature is already at a higher threshold there, so you're at higher risk of heat illness. If you have long-standing diabetes, if you're obese, if you have a history of heart disease, those all increase your risk as well.
Okay, if someone's had heat stroke before, I think to myself, I kind of had that heat time at the baseball field. Does that mean I'm more vulnerable or more likely to have that again?
Yes, you are. The joke in sports medicine orthopedics is the biggest risk factor for something is if you ever had it before. But it's true in this case. In one study, they found that there's a 3.3 times higher risk of heat stroke in the next 2 years if you've had it. So.
Okay, so if that has happened to you, then you know that you are vulnerable to that. You have to take extra precautions. All right, so can you still get heat stroke if you just drink plenty of water? I know a lot of people say, I hydrate all the time, I'm drinking plenty of water, I'm not going to get heat stroke.
So just keep in mind, that's just a risk factor. So if you're dehydrated, so yeah, it's great for you to do that. Make sure you're drinking plenty of water, drink based on thirst. But yeah, if you are drinking plenty of water, that doesn't mean that you can't get heat stroke.
All right, and what steps should we take to prevent getting overheated and having that heat illness kind of like sneak up on us? If we know we're going to be out at some place that's hot and stuff like that, how can we prepare ourselves?
Yeah, and this is probably the most important takeaway, besides understanding what the signs and symptoms of heat illness are. So first of all, if you can avoid being out when it's the hottest and sunniest times of the day between 10 a.m. and 4 p.m., and I know we're going to be out there sometimes, but if you're going to exercise, trying to avoid those times. You just mentioned it, hydrating, hydrate again, keep hydrating. That does decrease your risk. Making sure that if you're outside, you're wearing light colored, kind of loose fitting clothing. And make sure that your arms and legs are exposed. So you have that surface that you can sweat off and it evaporates and cools your body. Wearing a hat, wearing sunglasses, those are things that will keep the radiant heat from increasing your body temperature. And then just understanding that, it does take us up to 14 days to acclimate to heat. So if you're going to train for a race that's in a month or something, just understand it takes up to 14 days for you to get to that point where your body's, increasing how much water you have in your body, so that when you sweat, more of that comes off, and you're able to cool yourself faster. So those are probably the most important tips, I'd say.
I know a lot of times people say, okay, you get a little overheated, what's the big deal? But there can be permanent damage from heat stroke.
Oh yeah, absolutely. So nerves don't heal as well as a lot of other things in our body. So don't take your brain, take your nerves for granted. So.
I mean, how long does like some kind of recovery for that typically take from heat stroke?
It really depends on the consequences. And honestly, there's like a wide range. You can't really say like, well, if you've only had it for a minute, you're fine. So that's why we really stress prevention, because like you said, you can have permanent brain damage as a result if you don't cool these people. And of course, some people have unfortunately died as a result. We want to avoid that.
I know we're talking about hydration and water and all that kind of stuff. What about energy drinks, because they're so popular?
Yeah, so a couple things to avoid. So a lot of caffeine, which these energy drinks, you can't get through a checkout line without seeing them right there for you to grab. So a lot of caffeine increases your body temperature and puts you at risk. And also alcohol. Those are the biggest things to avoid. Water is sufficient for the most part, though if you're outside for more than an hour, some drinks that have electrolytes and some carbohydrates, those are good to reach for as well.
All right, we got about a minute left. Final thoughts on heat illness, heat stroke, what we need to do?
Yeah, so the biggest takeaways, again, watch this video later, look at kind of the important things to help prevent it, try to avoid the sunniest times of the day, Understand what the risks are and understand what your symptoms. Listen to your body. If you're getting that headache, you're getting dizzy, you're getting nauseous, take yourself out of that environment, regardless of how much hydrating you're doing. Be safe.
Yeah, take yourself out of that environment and maybe tell someone too. Because I remember I thought to myself, I
Exactly.
feel weird. And I had to tell somebody because I'm like, ooh, this is getting strange. So I appreciate that. If you want to redo this interview again, you want to listen to it again, maybe send it to somebody else who you think needs to hear it. It's going to be in the 2-year well-being section of our website. We appreciate you joining us. For sure, right now we're going to take a look at the forecast. I heard some thunder out there, Tim.